Hello. Now we will be studying about the first cervical vertebra, which is also called as atlas. It is an atypical cervical vertebra. It is called atlas because in Greek mythology atlas means god. It is just like how the god rotates the earth on his shoulders. Similarly, this bone, that is the first cervical vertebra, will hold the skull over it. That's why it is named atlas. So it is atypical because this one is a typical cervical vertebra and this is atypical. In what way this atypical cervical vertebra is different from this typical one? So clearly you can see there is no body here. Similarly, there is no spine here. This bone is ring-like and the foramen transversarium is widest apart. This atlas bone, it is said as atypical because of these four features, because it does not have a body. Anterior tubercle represents its body. It does not have a spine. Posterior tubercle here represents its spine. It is ring-like and the foramen transversarium is widest apart. Now coming to its attachments and features. Since this atlas does not have a body, instead it contains here in front which is called as anterior arch, which is narrow, and similarly this one is the posterior arch or posterior lamina which is wider. This anterior arch consists of anterior tubercle in front which represents the body. To the upper border of this arch, it is the anterior atlanto-occipital membrane is attached. Before this, how to keep it in anatomical position? The anterior arch should lie in front, the wider posterior arch should lie behind, and this superior articular facet should be long and concave, and the inferior articular facet, it is flat and somewhat oval or circular. So you should not say this as anatomical position. The anatomical position is this because the superior articular facet should be long, elongated and concave because it should articulate with occipital condyles of the skull. So these are the occipital condyles of the skull which are long and convex. They fit into this like this. Hence, this is the normal anatomical position. Okay. Now, coming to the other features, to this anterior tubercle here, it is the anterior longitudinal ligament attached, and here I have said it is anterior atlanto-occipital membrane is attached. On the posterior surface of this anterior arch, you can see a rounded facet, which is meant for articulation with the facet, this facet, it articulates with this facet on the anterior aspect of the odontoid process of second cervical vertebra, like this. Is it clear? Now, I am removing this. Rest of the features like this one already we have discussed about the superior articular facet, and this one is the foramen transversarium, which transmits the vertebral artery from below upwards like this and the vertebral vein from above downwards, and this vertebral artery after emerging out from this will now become the third part which crosses like this and makes an S-shaped loop here and arches over this posterior lamina and enters above into the foramen magnum. Now to this transverse process here, on its superior surface, what is attached is the superior oblique muscle like this, the origin of superior oblique, the attachment of rectus capitis lateralis and the levator scapulae posteriorly. This one is the posterior lamina or posterior arch. Onto the superior surface, it is the posterior atlanto-occipital membrane which is attached. and the vertebral artery and the first cervical nerve passes on its superior surface like this. There is a thin shallow groove meant for the passage of these two. On the inner aspect of this vertebral arch, here you can see a transverse tubercle which gives attachment to transverse tubercle of a transverse ligament of atlas on either sides like this. Like this, in the living, there is a ligament called transverse ligament of atlas. That ligament and this anterior arch forms, this arch forms the osseous part and this forms the ligamentous part, thus forming a ring called osseo-ligamentous ring, and this ring rotates over the odontoid process like this, making a pivot type of joint. I repeat, around this odontoid process of second cervical vertebra, this osseo-ligamentous ring formed by anterior arch and the transverse ligament of atlas rotates, this rotates, forming a pivot type of joint. Now coming to this one here, there is no spine here, but there is a small projection here which we call it as posterior tubercle. This posterior tubercle represents the spine and this gives attachment to the ligamentum nuchae. So this is in brief about the atlas or the first cervical vertebra, which is an atypical cervical vertebra. Thank you.